wondering, will it hurt? How's it gonna feel? What would you tell someone who's reluctant to get care?
It's been painless for me actually, and I feel like I can go about my normal life.
Wonderful. Here we go. Tell me something, is this or this tender when I touch here or here?
Right side.
The right side. So let's get that going. Here we go. And I'm using a virtually painless technique to mobilize the joints of the pelvis, the sacroiliac joint in particular. This instrument vibrates at 40 hertz. It puts out a vibration of 40 hertz, which is the same frequency of the human body. And I'm going to use a special attachment to open up the spaces between the vertebrae where the discs are. And how does that feel?
Totally fine.
And you've just started care here. And what have you noticed with care?
What have I noticed with care? I have like better mobility. I have better range of motion, especially on my right side. It's been an issue for like 10 years.
About 10 years. So she's having problems with her right hip in particular. When I push the hip out, it moves just fine. But when I pull it this way, it's all locked up. It doesn't move nearly far enough. I'm gonna work on the muscles that internally rotate the hip. And I'm getting right on the muscle insertions of the right hip, and you can see where I am. Here we go. And I'm gonna feel with my hand to make sure she doesn't have knots in her legs. And check the muscles there. And I'm gonna do the same test again. I'm gonna move it out, and I'm getting a little bit more movement in internal rotation, but I wanna get more movement in that hip because this is what's holding her back, right in here, right in here, right in here. And a lot of people have hip problems. And how does that feel?
Good.
And I'm gonna feel around the hip joint itself, and I'm gonna work on the muscles here. She's got some tightness in those muscles, and I'm gonna use a acrylic massager over the muscles in and around the hip joint itself. She's got a little bit of scar tissue in here, and I'm breaking up the adhesions with the instrument, and I'm working in and around the hip joint itself. And the technique that we're doing is called impulse or neuromechanical technique. Is this tender?
Just a little bit.
Just a little bit.
Yeah.
And this leg moves fairly well. Again, during internal rotation, she's just a little limited. So I want to make sure that both hips are moving properly. And I'm feeling with my hands, I'm feeling for knots in the legs, and she's got a little trigger point or some scar tissue in her lower leg, and she's quite active. And we'll work the left hip as well. We'll work to get things moving again and to allow the body to regenerate. When we're in good alignment, we tend to regenerate. If the bones are crooked, the body breaks down or decays or degenerates. So we want to get her regenerating. If she's in good alignment, she'll stand her best chance of being and staying healthy. Bring your head in the middle. I'm going to check her neck and make sure that it moves correctly. And to the left, she's moving fairly well. To the right, it's a little locked up at the top. There's a discrepancy here. That you could see this, that to the left, during left lateral flexion, she moves well. But to the right, she's all locked up. She's locked up here in her neck. And I'm going to make some adjustments. This is called a chiropractic adjustment. At the top of her neck, I'm going to adjust the third cervical vertebra. I'm going to adjust her atlas, where the vagus nerve comes out. And adjustments here help with headache, irritability, fatigue, nausea, vomiting, blurred vision, loss of memory, loss of concentration. They cut through stress, and she's moving a little bit better after that adjustment. So I'm checking her movement left and right. I'd like to get a little bit more movement here. So I'm not going to force anything. I'm going to work with her body and use a vibration, and that's moving a lot better. That released really well. She relaxed for that, and that looks more symmetrical. And I'm going to get some of the knots out of this area. We all carry stress here. It's almost as if we have our shoulders up in our ears. We carry that much stress. And I'm going to work with the massage device and work on her shoulders too, and I bet that feels pretty good, right?
Oh yeah.
And just sitting at the computer, most of our work these days is at a computer terminal. You do that
Yep.
throughout the day?
Yep, that is where I'm at.
Alrighty, so I'm going to release some of that tension and some of that stress that builds up with computer terminal use and work out some of the knots. That feels pretty good, right?
Oh yeah.
Right in there.
Yeah, a lot of it's been released in the last few days.
All right, we'll get rid of some of that junk in there. So there's what's scientists call metabolic byproducts, the byproducts of metabolism. And it gathers in the muscles. And when we're still, we don't get rid of the junk from the cells, the garbage that the cells produce. And it gathers in the muscles, and we get all knotted up. And I'm getting in over the muscles that are knotted up and holding her back. And I'm working the muscles on the sides of the spine. I'm giving her a nice massage and breaking up some of the adhesions, some of the so-called trigger points. And I'm feeling with my hands where there's inflammation and swelling in the joints. And I'm going to make an adjustment here because it helps with blood pressure. It helps us avoid bronchitis, heart palpitations. Adjustments here help the immune system, help us breathe easier, help us stand well. She has a vertebra that's out of alignment here, and I'm going to make an adjustment here too, and that'll help build her resistance. She could become so strong, she doesn't get sick in the first place. And I'm making adjustments here too, and here. And this helps the kidneys, the adrenal glands as well. With this.
It feels great, honestly. You don't really feel much. You just feel some vibrations. It's really what you feel after. A lot more.
So what would you tell somebody who's reluctant to get care, who's scared?
Come get care. If there's any hesitation, seriously. I wish I would have done this a lot sooner. I would have been out of a lot of pain a lot earlier.
So had you been in earlier, you would have noticed results faster.
100%. Yep.
So I'm going to turn her hip out. I want to make sure that her hip is okay and her feet are nice and even. And I'm going to push on her hip and I'm going to pull on the hip joint itself to make sure that it's absolutely balanced. Is there anything else you'd like examined today?
I think you got everything.
Yes, I did. Here we go. Share if you care. Like, comment, subscribe, and I'll be back with something powerful and positive for you and yours.